We've all heard that practice makes perfect. But did you know that it can also change the brain? That's why practicing some skills, like music and dance, can help patients with brain-related conditions. My name is Falisha Karpati, and I'm going to tell you how dance and music can tune the brain. Imagine yourself as the star of a ballet or the lead guitarist in your favorite band. Your brain is getting information from multiple senses, like listening to the music you're moving to or producing, watching a conductor or choreographer, and feeling your body touch the floor or an instrument. Your brain is not only combining information from all of these senses together, it's also combining the sensory information with your actions. This makes sure that your dance movements, or movements on your instrument, happen the right way at the right time. We know that music training affects the brain. The brains of musicians are different from non-musicians, and as little as 2 weeks of music training can change the brains of adult non-musicians. Also, music therapy has shown positive effects in people with brain-related conditions like stroke. If practicing music can change the brain and help patients, then can dance do that too? That's where my research comes in. I compared the brains of expert dancers to expert musicians and to adults without any dance or music training. I found that the dancers and musicians had similar brains, and both were different from the untrained group. Both the dancers and musicians had a bigger part of the brain in the area just above the ear compared to the untrained group. Brain size in this area was also related to scores on measures of dance and music abilities, like a dance video game and detecting differences between melodies. This brain area is called the superior temporal gyrus. It has many functions, including combining information from multiple senses and combining sensory with action information. As we reflected on earlier, these are processes that we practice a lot when dancing and playing music. This shows that practice doesn't only make perfect, it might also change the brain. So now we know that dance training and dance abilities, just like music, are associated with brain characteristics. So what can we do with this information? We can apply it to dance therapies. Dance therapy has shown positive effects in patients with brain and movement-related conditions like Parkinson's disease. My findings of a relationship between dance and the brain help us understand how these therapies might be working and will help pave the way for the use of dance in brain-targeted interventions. Thank you.